That's the 26th one that I did.
Alice is muted.
I saw the transcription though, so that was probably something, right?
Can you tell me that, because nobody's responding to me?
That's better.
That's better.
Can you hear me?
That's good.
Okay,
That's
great. All
better.
right. Okay. Thank you all for waiting. A lot of technology, new technology for us trying to figure it out. But my name is Rainey Grant. For those of you who don't know me, I'm the community builder for the Near Eastside Quality of Life Plan here at the John Bonner Neighborhood Centers. And I'd like to welcome you all and thank you for coming out to the Near Eastside Public Safety Summit. And we're very glad to have some quality information for you all on public safety on the Near Eastside. I would like to thank our lead agencies who basically run the plan. That's the John Bonner Neighborhood Centers, Inglewood Community Development Corporation, Thomas Perry Neighborhood School, Westminster Neighborhood Services, and there's always at least one that I forget. Near East Area Renewal, thank you. I can always only remember 4 of them, and they're not always the same 4. So we're just going to go ahead and get right into it. I would like to welcome Clint Mercicleo. He is the president of the Safety Community Action Team, the resident arm of the safety focus area for the Quality of Life Plan, and he will be giving a presentation as well, also introducing a trainer tonight. So Cliff, you want to go ahead and come up here?
Yeah, it is.
So you can always start on this little bench here.
I'll do it on the garden. I'll just bring it in here.
Oh, hello, everybody. Clint Mercicleo. I'm surrounded with my team over here, Marguerite, Christoph, and we're going to have Jess present in just a minute. Well, in a few minutes, as soon as we get through our little introductions. So with the safety committee, as I'm trying to figure out how to use technology. There it is. Oh, nobody edited the. If anybody here wants to be a part of the safety committee, get out your phones. I have QR codes everywhere. These will give you all the links that we have for everything. Or you can email me at ccmarsig. Did somebody have something? Oh, okay. ccmarsig@gmail.com. And we're going to post this information again at the end. So if you have phones, feel free to scan everything. Otherwise, I'm going to send out all these PowerPoints to anybody who signs up for this meeting. Next, Chris, come on up here. Talk a little bit about NESCO and our efforts with the crime reduction court enforcement, as well as some of the things we do with land use. You have 5 minutes at most.
So if any of you don't know me, my name is Chris Cobb. I am the current chair of the Crime Reduction Code Enforcement Committee for NESCO, and have been for several years. I'm also now the president of NESCO. And to start out, I'd like to thank John Bonner Neighborhood Center for their quality of life plan, and all of the community builders in the past that have helped promote and keep this in motion. One of the things I'd like to talk about is change. Quality of life plan is never anything that's complete. It will always change. There's going to be things that needed added, things that might get completed, but there are a lot of changes that will happen with the quality of life plan. And as the Crime Reduction Code Enforcement Committee, our next meeting will be on July 11th. We've been at the Englewood Christian Church. Thank you for being such a good partner for the NESCO Crime Reduction Code Enforcement Committee. We try to keep things consistent, and sometimes change isn't good, but if we keep everything consistent, then at least people know where to go to. So one of the things that I'd like to say is we, over the years, can expect change. We've had different mayors, different administrations with IMPD. We've had changes within command staff, and everything brings some new challenge, some new change. Over the years, Mayor Hogsett first came in, then the new police chief, Brian Roach, they came up with a plan called the Community Resource District Council, which there was one in each of IMPD's each district, and I was nominated to be the chair for all of each district, and rapidly found out that I was being stretched very thin. As the pandemic hit and more demands happened on the far east side than the near east side, then talking with the commander, who happened to be Craig McCard at the time for IMPD East District, we decided it was smart to split that into areas that I felt more comfortable, which is my near east side neighborhood. So without doing alphabet soup, the crime reduction and code enforcement is also the Near East Side Community Resource District Council. This is something that we didn't want to change because it would be confusing, so we stuck with the crime reduction code enforcement, which is basically doing the same thing as the Community Resource District Council. So one of the things that I'd like to kind of also talk about is technology changes on us constantly. Currently, you may have heard about the new system that's being implemented on the Near East Side. One of those is gunshot detection systems. For our July 11th Crime Reduction Code Enforcement Committee, we're working to try to get a presentation from the group called Shot Spotter. They have already installed a lot of microphones in the Near East Side. So far, I think I'm up to like 50 microphones that I have counted on the Near East Side between 3 vendors. And they would like to tell you what Shot Spotter is all about. The other 2 vendors we may be hearing from at a later date. This is something that's just a trial basis so that IMPD can then collect the data, see which data comes in the best, and make the best decision as to which vendor would then happen. So, appreciate the city doing their due diligence and choosing the best package available that the community and taxpayers can afford. So that's coming up on our July 11th Crime Reduction Code Enforcement Committee. I'd also like to point out that NESCO has been around for 51 years, and it's been a total volunteer organization, such as the same as our community action team. So I would like to thank Clif Mercicleo for his time as president of the Safety Action Community Team, as well as Marguerite Topping for her priority 3 for the quality of life. I also handle priority 1 of the quality of life safety cat, which was basically the crime reduction code enforcement committee. So if any of you have a need to contact me, I think one of our future slides coming up has my email as well. If anybody is interested in knowing what beat they live in for IMPD, I have maps that you can figure out which beat you reside in. We do have a very good conversation with IMPD and their community resource unit, and talk to them quite often. So if you're having any issues, please let me know. I would like to invite everybody to the July 11th Crime Reduction Code Enforcement Day. July 11th, Englewood Christian Church, 5:30 p.m. Thank you.
Thank you, Chris. And next, we're going to talk briefly about some of the initiatives we have in town, such as the community emergency response team. I'm going to let Marguerite Topping give a brief spiel about this. I'm putting her on the spot. You can talk about that. I will put her in the chat.
Okay, great. This is one of the many agencies and programs that we are trying to make more public and more available to the Near East Side, because stuff happens, disasters happen, and they happen in your home, they happen in your neighborhood, they happen in our city, our county, and in our state. It's just as a matter of scale, and it's just a matter of when it's going to happen. Community Emergency Response Team can prepare you for any disaster. in your home, in your neighborhood, in the city, to be able to assist and respond to your nearest and dearest, or to your neighbors, or to a major disaster. If anything happens, we've got hurricanes, we possibly have the Madrid fault, give us an earthquake sometime, it could happen. But it is a training that is absolutely invaluable to saving lives, and it is free. It is coming up on August 13th, 2027. There's like, 3 Saturdays in a row. And as you can see, hit the Q code, or that's the URL to sign up on Eventbrite. Please, yeah. Any question?
Is it a 3-part training, or those are just 3 different options?
No, it's a 3-part training. You gotta do them all if you want to qualify to graduate as a cert basic training graduate. But each day is absolutely invaluable. You'll learn about basic first aid. You'll learn about how to prepare your home in case, there's any kind of a disaster that would keep you from accessing sewer, water, electricity, as we know happens all the time. We're on the east side here, just a matter of how long it can happen. So how to, respond in case there's an accident on your street, how to help somebody survive until the professionals can get there. That's what it's about. Sign up if you haven't done it yet.
Thank you, thank you. This is what when I ask people to when I put them on the spot, they're better than when I'm actually prepared. So thank you, Marguerite. Continuing on with a lot of the public safety that we focus on, we're talking about gunfire or firearm safety. We know in a day or two, is tomorrow July 1st? Tomorrow is July 1st. Here in Indiana, laws are changing. The state police, or if you have access to Twitter or Facebook, look up Indiana State Police. They are putting up tutorials about what's going on with the new laws, how to navigate the new laws, open carry as well as otherwise. But along with this, the Marion County Prosecutor Office is actually offering free secured lock boxes for anybody who does wish to carry. It's trying to save the lives of kids. So go to this QR code or go to saferindy.com. And I was also asked to remind everybody, 4th of July is in 4 days, and bullets go up, bullets come down. Don't shoot guns in the air on 4th of July. I know nobody in this room is going to do it, but if you hear it, just stay safe. Next. Oh, and this is part of the, we have, if you're here in person, we actually have, flyers. Yes, we have flyers. They're both in English and in Spanish. That tell you how to get these secure boxes. But again, go to the URL that I had on the last one. If you download the slides, what's that? Microphone, yes. Sorry. Yeah, go to there. This will tell you how to do it and how to do everything right. Next month, we are having National Night Out. Marguerite's area has their little flyer up there for National Night Out in Little Flower. On the east side, most neighborhoods have their own National Night Out. Talk to your neighborhood association, get to know your neighbors, or join our friends over in Little Flower. It's a public safety. It's going out at night. It's IMPD usually comes and visits everybody at the National Night Out. Firefighters come to a lot of these. It's pretty much trying to meet your public safety folks, and it's trying to show you that if neighbors are out at night, And you all, there's security in numbers, and we're the ones that are protecting our own communities. We can't ask everyone else to protect our communities. We protect our own communities. Yes.
On our previous item,
Please.
yeah, about, the Peace Park project
Yes,
will be at, IMP Community Day.
okay.
I'll be volunteering and drop by.
Oh, and July 20th. We'll get to that.
Oh, yes, as noted by somebody in the audience, what was your name, sir?
Dennis.
Dennis. As Dennis mentioned, they're going to be handing these out at, you said Community Day? IMPD's Community, Brookside Park, July 20th. 11 to 2. Thank you.
I know, I just signed up to be a volunteer through the Mom's Plan Act.
Thank you for volunteering. Okay, as we get closer to our main event, we just need to remind everybody that public health is public safety. COVID vaccines are now available for kids five and older, free of charge to the Marion County Health Department. And adults who have not received a fourth booster are now eligible. Go to rshot.in.gov for more information. And yes,
Right here.
yes.
Also, give them the name of Deborah Webster. who's
What is
now-
it?
Deborah Webster,
Devery?
who's the outreach person with Marion County Public Health for vaccine and vaccine shots in COVID-19.
Devery Webster with Marion County Health Department?
Yes, she's willing to come to any group or organization to make a presentation to explain all about the. Yeah.
Do you want to come up here and say it?
No.
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 I would just-
I'm not. Okay, so she's willing to come to any organization or church or any affiliation to give the information, the up-to-date information on vaccines, and also she has testing kits for those who want to test and if they think they've been exposed, and they're free. And
So-
she'll give them out to you, okay?
So Devery has, Devery, what's the word?
Deborah with
Devery,
D-E-R-E-E, Deborah.
Devery Webster with Marion County Health Department has
What's that number?
221
221
2000
2000
and ask to speak to Deborah, okay?
and asked them to speak to Devery.
Yes, that's good for, okay?
Thank you.
Okay. One more thing.
Yes, one more thing.
Going back to your national night out
National
in the afternoon, and Chris will tell you this, I'm sorry, Chris didn't say that. They have the Crime Watch Citizens of the Year Awards, which will be at the Legacy. Right, Chris?
Chris, do you want to talk about national, you want to talk about this? You are amazing with National Night Out. Say a little bit more about it.
So first of all, National Night Out is a national holiday. And we have applications if your neighborhood would like to host a national night out. We'd like to have these registered because they do go to the prosecutor's office, IMPD, fire department, first responders, all. We'll try to attend your event if possible. We are honored this year because the National Night Out also honors Crime Fighters of the Year. And East District this year has been chosen to host that. And again, John Bonner Neighborhood Centers have been very grateful to step up. And we will be having the National Night Out Award ceremony at the Chase Legacy Center or just Legacy Center?
Either one works.
The Legacy Center over here by Tech High School. I believe that starts at noon. So IMPD and city, federal prosecutors. We'll have a lot of dignitaries in our neighborhood. This is a great way to show display to the community that you care about public safety and reducing crime in the neighborhood.
When is that, Chris?
August 2nd. So it's pretty much all day affair.
Thanks, Chris.
So you can have it from 6 to 8, 7 to 9. Some people will have cookouts. Some people have little giveaways for any of the officers. I think Woodard Place used to do an ice cream social. So it's up to you, whatever you want to do, but please register your neighborhood for National Night Out.
Thank you, Chris. Thank you.
Thanks for the prompting.
Thank you, Anthony. You are amazing. I'm going to get you up on in front of this one of these days.
One of our safety camp members.
Yes. Okay, and last of all on this, on July 25th, the Indiana State Legislature is going to convene special session talking about the U.S. Supreme Court concerning rights to concerning reproductive rights. If anybody needs a referral to clinics or otherwise, for other than your current position, we will provide information. We are here focusing on public health and public safety because, again, public health is public safety. If anybody needs a referral, send an email to protectlittleflower@gmail.com. Do you want to speak about anything more about this?
Yeah, I just want to say if anybody is also interested, oh, sure, get over there. If anybody is also interested in finding a physician who will, if you're a woman or a man and you wish to be sterilized, I can also have a list of physicians who won't give you any psychological back talk. They will ratify your request and get it done in a safe and effective and prompt manner. Email me.
Email her, and if you need that list, email Marguerite at protectlittleflower@gmail.com. We're going to send out copies of these slides to anybody who signs up for this presentation. So when you get the email, send the email back and we'll get you to Marguerite. And here, finally, thank you to the John Bonner Neighborhood Center. We now have Naloxone boxes on both sides of this building. Thank you. And thank you to Rainey for making this happen. You were amazing in all your help with this. Same with Jess Cochran and Marguerite Topping. Without all three of these, we wouldn't have had these here. So a Naloxone box is a confidential box. It's unlocked. There's no cameras on any of it. There's no cameras on there. Okay, there's no cameras available. You literally walk up to the box, you open it, it's not locked at all. You open it up, you take the naloxone, it's confidential. I would say anonymous, but others may see you take it. So they are on both sides of the building to make sure that you can get it however you want. And that's what the box looks like.
And I'll tell you why.
Yes, and that's what
to do with it.
And now for the main event, Jess Cochran is going to tell you why we have these Naloxone boxes and how to use them. You want to stand up here and move things?
No,
Oh, you can move.
stuff.
Okay, I can move.
Yeah.
You need to hand things out.
We can at the end, everybody here, y'all get to leave with as much naloxone as you want. If I don't have enough with you today to gratify everybody's desire, you're just gonna tell me how much you want, and then I'm gonna bring you more. And that's right. So we've got big old box. We have fentanyl test strips in here. If folks are interested, some of our naloxone boxes that we have around the city also have this harm reduction tool in it. But yeah, let's talk naloxone and then we'll get to all this other stuff. So when we talk about naloxone, and I know you guys and Mark has told me we don't need to make this in the east side one of those, let me convince you that this is a useful tool. But I do want to make sure folks know a couple of points that sometimes don't get covered in these trainings, right? So I want people to know what it's like in Indiana. You guys are totally legal to have it. We're gonna talk a little bit about why it works. So that then y'all, if you have to give it to someone else who might not use the naloxone to reverse an overdose while you're standing there, knows a little bit about what's happening, right? Like to educate everyone on the process too, so they know what's going on. What's up?
Just talk about your background and
Oh my gosh.
your organization and how you know this stuff.
Mark's gonna make me back up. Okay. We'll go back to 2018. My name is Jess Cochran. Oh my gosh, I hate it, and then I can't do it. All right, I'm Jess Cochran. In 2018, my spouse and I started the Never Alone Project. So we are Indianapolis's community-run, drug user-led, neighborhood-focused crime reduction agency. Since we started, I'd say that we've probably serviced about 20,000 drug users in Marion County with harm reduction tools, education, safer use supplies, referrals to treatment. We have a peer recovery program that's run by folks in active substance use. We've got some street outreach teams, and of course, we work with great organizations like the Bonner Center to put up things like Naloxone boxes. We've got in the East Side, Naloxone available at all sorts of spots, including Rabble Coffee. The Emerson Theater has a bunch of our Naloxone and harm reduction supplies, as does J. Clyde's Pubs. So we're kind of here trying to make sure that the community has all of those tools to take care of ourselves, right? Because we know outside of all of the issues that people in active substance use have, sometimes accessing those, like appropriate channels, we also know that everybody else is super busy. And we know that the sooner that we learn how to take care of these things with our neighbors and our community, the easier it's going to be to get all of this overdose, Hep C, HIV syndemic stuff under control, right? So that's kind of where we are, where we're positioned. We started this agency. My husband has a background in EMS support. I'm an epidemiologist with a background in infectious disease virology. Also, we're both long-term substance users. So we're kind of at this point where we've lost so many people, we put our noggins together. And here we are. Now we're going to talk naloxone. Talking about me is way less comfortable. What's up?
Just don't forget to mention the role that Marion County Public Health played in this whole area where there was a problem with substance abuse. And then they brought the mobile unit out here, and then a safe syringe program. All those are pilot programs that were started in this area.
Yes. So we know Near Eastside has had, a really long history of supporting, and really we've seen a lot less pushback from the community in Near Eastside. So we've got Marion County Public Health Departments. Van has been in several different East Side locations, right? So over at Brookside Church, we've got them over partnering with Damien Center as well, who right now is also taking a look at, especially 46201 area code. A lot of what the Never Alone Project does is also on the East Side, but we service the entirety of the city. So kind of we've got a different focus, different group of folks that we're working with, but of course we're all working together to try to figure out how to get exactly what's going on under control, right? And that is keeping people alive until or if they wish to seek some sort of treatment and substance use, right? And for some folks that doesn't happen, and that's okay because we're happy they're here anyway, right? See. All right, so we're not gonna watch a video, but what I am gonna let folks know is it's super. Is it me? It's just
Sometimes
me.
the toucher that does that.
So opioids sit in these little holes in your brain, right? The receptors, and only opioids can sit there. Everybody's got them in their brains, right? The way naloxone works is it comes on like a big hit on the playground and it kicks the opiates off of those receptors and it takes their place, right? So this is super critical to understanding before I even show you how to use this, what this stuff is used for. Receptors are super specific, right? Our brains have a whole bunch of them. They all kind of look different, and only certain things can fit on certain ones. So naloxone, because it takes the place of those receptors on your brain that fit opiates, it only works to reverse an opiate or opioid overdose, right? Those things can look a couple of different ways. But all opiate overdoses result in not breathing, right? You take too many opiates, what happens first is your brain gets really muddy, you get really sleepy, and those signals that tell your brain to make your body breathe and oxygenate stop, right? So one of the other things that I need for folks to understand about naloxone, and when we're talking later about rescue breathing, and I'm going to tell you this 1,000 times, I don't want to hear of anybody doing CPR and chest compressions on somebody that they're giving naloxone to. It's a waste of time. Rescue breathe, just rescue breathe, right? Please don't break anyone's ribs. All right. What we do know is that once those receptors are full of opiates, you get those signals to cease breathing. I can give you all of the naloxone in the world, and if I've waited for too long to do so, it isn't going to help. Right? So naloxone always works on all opiates. Sometimes you have to give more, right? Sometimes even the bullies on the playground have to team up against all the big kids, right? So more Narcan if it doesn't work, but it only works on opiates. And that the mechanism of action is it kicks it off those opiates on your receptors and helps you breathe again. The breathing piece is especially important because if you don't have naloxone, if I don't have naloxone, rescue breathing and oxygenating people will keep them alive, period. Fentanyl, super fast half-life. That's why people that are looking and are at this point using just fentanyl are using more frequently because the drug wears off faster in your body, right? Heroin's got a faster half-life than some of your extended release oxycontin, right? We know drugs take different amounts of time. This stuff, regardless of how long that drug takes to come out of your system, the rescue breathing will work if you continue it, right? So if you see somebody who is going blue, who isn't responsive, who you think might have had an overdose, and you don't have Narcan, we're calling EMS, and then we're going to start with rescue breathing, right? We knew that this stuff worked. Recently, we've seen some data coming out of places, even in New York, where they've got overdose prevention centers, where they're allowing folks to use under medical supervision. All of the overdoses that they have reversed at this point have been reversed just by oxygenation. They're not even using naloxone. And if they are, they're using tiny dosages and just titrating people out really comfortably because they have the time, they've got the medical staff, right? But if that's what we can do in overdose prevention centers, we can do this, right? So tools or not, naloxone or not, we're going to talk about rescue breathing, the next fun part. But avoidance wise, if y'all are talking to folks, sorry, these are all pulled from a different presentation, and I'm trying to figure out exactly where they're taking me. Avoidance wise, if y'all are talking, especially to younger folks, right? People that you might know, people in your community that are like, hey, yeah, naloxone works, but what do we do so that we don't have to use it? What I want folks to know is that mixing drugs, any types of drugs, uppers and uppers, downers and downers, right? We all know that taking like too many downers together is a bad idea because you just go to sleep and then you're done, right? Mixing things like something that makes you go fast and something that makes you go slow, your old methamphetamine heroin mix, will increase your chance of overdose from either of those because your body doesn't really know what signals are telling it, right? Like our brains can only really handle so many things. And if I tell you to go super fast and super slow at the same time, my brain might be like, you know what, I'm not actually sure what it is that I'm supposed to be doing. So I'm gonna take a moment and we're just gonna stop, right? And this is not best. The other thing that we're talking in terms of safety with folks is that all of the days of buying weird unlabeled white powders in bathrooms that I'm going to go search and this guy at the gas station, those days are over, right? If you don't know the source of something you're putting in your body at this point, then we're increasing our risk of overdose. Unfortunately, we don't have any great ways of testing substances in Indianapolis. We have our fentanyl test strips. They're handy, but they won't tell me if there's something like a tranquilizer, which we're seeing more of, right? They won't tell me if there's a benzodiazepine, if there's some sort of Xanax, right, that's been mixed into it. It won't tell me any of that stuff. Narcan won't work on that stuff, so safety wise, we just tell everybody, if you're in active use, I need you to pick a buddy and only deal with that buddy, right? We know that this is a good strategy because a lot of the folks that we distribute naloxone and supplies to are actually engaged in the economic transfer of substances. They don't want to kill their clients. That's a stupid economic decision, right? Nobody makes money if everybody who gives money dies. So we know that we can do this. And if y'all are talking to folks in the neighborhood, just encouraging like, hey, that whatever that was, maybe we don't talk to strangers in the gas station parking lot and decide that what they've given us from their pocket's a good idea, right? Identification wise, we're talking blue, limp, fentanyl sometimes will make people really, really rigid. Called like fentanyl rigidity. We talk about people getting little T-Rex arms because it kind of makes you really squeezy. We used to let folks know that if you were rigid, usually it was a stimulant overdose, and if you were noodly, it was opiates, and fentanyl changed a bunch of it. So the important thing that I want everyone here to know is that we Narcan people who are unresponsive, and that's about it, right? If y'all come across somebody who's like a little too high for your comfort, we just help people get off of the streets into someplace cool where they're safe. Hopefully with somebody who knows them, someplace where they're not going to be in danger, but we don't do Narcan, right? Because it kicks all of those drugs off of your system. If you're used to having them on there, it can make you physically ill. So we just don't really mess. But if we have somebody who is not conscious and who isn't responsive, I want people to check by stimulating. So I'm going to go back. I don't know. Anyway, this is what we're going to check. We're going to check whether or not folks are conscious or responsive, first by saying their name if you know it. If I'm using and I'm trying to like escape or chill out or go in my own little headspace and I hear, hey, are you okay? And I don't know you're talking to me, I'm probably not going to answer you because I've already decided that I'm not dealing with people at that moment, right? So, hey, Jess, are you all right? You can see if they'll answer questions. Often I tell people I have to Narcan you if you don't get to it, right? Nobody wants to be Narcan if they're just trying to be high, because again, it'll ruin it, right? Or I'll tell people I gotta call 911 if we're not like up and at 'em about 20 seconds, kid, right? If it doesn't work, the next thing I want folks to do is a sternal wrap. I don't know if your cert folks have been trained on these, but make your hand into a knife blade, this hard bone right here, right? Push and rub. You rub skin off. Just actually try to get them off, right? If there's a lot going on here, if it's heavy coat season, if you don't feel comfortable because you aren't entirely sure who this is and whether your hand needs to be right there, it's all good. You can do not a sternal rub, but an under the nose rub. You have a pain receptors right here, a pressure point. It's the same thing. If they are able to move or tell you to stop, they are going to do that, right? Try, like if anybody doesn't believe me, y'all can try, but it really does hurt. If they don't respond to you, this is when we start talking about this could be an overdose and we need to use naloxone, right? So what is this stuff? We know it's only an opioid reversal drug. It was invented in the 70s and approved by the FDA, initially for use on newborn babies whose moms have had too many opiates during delivery, right? If they can use it on tiny babies, y'all are totally fine to use it on somebody who's overdosing, right? In general, everybody is really touchy about what they let doctors give to tiny babies, right? So this stuff's super safe, right? It's like sort of the standard of care is like, if it might be too much, we don't do it for neonates. So sometimes it's naloxone. Narcan is the trade name of this stuff, the nasal spray. It's like acetaminophen and Tylenol. They're basically the same thing. I don't think anyone's going to copyright violate you if you call the wrong naloxone Narcan. And we know that it only works by kicking those off, right? In the hospital, sometimes they'll put people on IV naloxone. It's not very often, not very frequent. This stuff works pretty quickly. Sometimes we have intramuscular naloxone, and you guys may have seen this. It comes in little vials and you pull it up. It can go in any muscle, right? We don't have as much of that now nationally because a lot of the little vials got reacquisition for vaccines, which is fine. I'm fine, right? We all need shots too. So we've got a whole bunch of this, which is absorbed through your mucous membranes, also super fast. The difference between this stuff and a lot of the other forms that people have seen prior, if you've seen other types of this stuff's pretty strong. It's got 4 megs and naloxone in it. It's cool. The old stuff, even the old nasal sprays, you had to split it up and part up one side of your nose and part up that, don't have to do all that anymore, but they combine the 2 doses together. So a word of caution about strength. If you've got somebody who potentially is normally going pretty fast, we're trying to stay up, and they've caught something that may have fentanyl or an opiate in it and they're overdosing, we're gonna hang out for a while after we give this much naloxone. Why? Because what do they do in the hospital when you're tachycardic and you're going too fast? They give you a system depressant, right? Well, opiates are a system depressant. So sometimes when we pull people up who are also on something that's making them go fast, they come up like a rocket, which is cool because you're breathing. It's not so good on the heart, right? So we definitely want to make sure that we've got eyes, or that somebody's got eyes, to make sure that we're not coming up breathing and then coding out, because that's not what we want to do.
So it works on opiates. What would happen if someone who's overdosed on something that's not an opiate is given the one? Does it hurt them?
That is an awesome question. So it only works on opiates. So what it doesn't work on is everything else, and it doesn't do anything else, right? So heart medicine, insulin, methamphetamines, ketamine, tranquilizers, heartburn meds, chemo. It's like irrelevant, right? The only mode of action for this is that mess with receptors that are pretty specific to opiates. It will work on all opiates. Sometimes people ask, oh, but I've heard that there was this really strong stuff and naloxone doesn't work on it. It'll work. You might have to give more, right? So what we're going to do if we see somebody, yeah, here we go. So these are not opiates. These are opiates. DMX is not an opiate or a non-opiate. DMX is a wrapper, but I had an intern make this once upon a time. But naloxone will not work on that either. Or on DMT, which I think is what we were talking about. We're not entirely sure. But right, so naloxone doesn't work on all of these things, but it also doesn't have an impactful action.
Or you might point out that fentanyl is so fast reacting that sometimes it's impossible to bring someone back if they OD on fentanyl. A lot not going to help at all.
Well, so I've been brought up after a fentanyl overdose on naloxone, so I'm going to push back on that a little bit. You have to give more naloxone, and you have to couple with rescue breathing. And nothing will ever bring anybody back from any opiate if you've been non-oxygenated for 12 minutes or longer. So what we do in terms of fentanyl, because it will work, is we make sure the other counsel, if y'all are talking safety, is that folks don't use by themselves. So what I told y'all is that we don't use this stuff on people that are just really high, right? We're checking for unresponsiveness. What happens if you're unresponsive and the way to fix that is only a thing you can do if you're conscious and you're all by yourself? Probably not even great, right? So I'll make sure that folks have it, but we've got a call line that people can call. We've got actual like phone sitters that'll hang out. We've got a number for the national EMS switchboard that we can call in, bypassing dispatch here, which is nice because they're busy. And we can get folks, EMS care if that's something that they need if they go out on the phone with us. So this stuff only works on this. Like I said, it will work on fentanyl, it will work on carfentanil, it will work on ISO, it'll work on bromorphine, it will work on all of the new analogs. We can't test for all the new analogs with our fentanyl test strips, which is a problem, but at this point, it'll happen. Other piece is that there's no mechanism for abuse of this stuff. Nobody's having naloxone parties. You can't take it before you get high to make you not get, like, none of that makes sense. Here's why. No one pays for drugs and then gets the anti-drug for free and then does the drugs they paid for so that they could use this free thing to make them not high anymore. Like, it doesn't. So, yeah. 3 things we have to do to destroy this stuff, and 3 things I gotta ask you to do if you take extra. Tell people how to use it. We're gonna get there in just a sec. You gotta instruct folks to call 911. We're gonna get there in just a sec. And offer a treatment referral, which is awesome because they're already in these bags. So you don't even have to do anything with that, right? You can literally just be like, shove this up someone's nose and call for help if you need it, right? This is how we do it. So first, we come across somebody where we think potentially has had an overdose, right? We're gonna try to stimulate. Can we get them to come up? Can we get them to have a conversation? Can we get them with it at all, right? If we can, we're gonna hang out. We're gonna see if we can't get them a buddy, right? Some of these things, especially if they are coupled with drugs of other mechanisms like speed, can take a sec to kick in. You can feel fine and then you feel not so fine anymore, right? We're gonna call 911. I'm gonna ask when folks call 911 that you tell dispatch that you're with somebody who isn't conscious or with somebody who isn't breathing, whichever of those are true. It saves law enforcement and EMS both times in response, right? And I'm sure, oh, actually, I'm not sure. I'm going to assume that some of y'all understand, like, right, when EMS gets called to something that could be an active crime scene, law enforcement got to come and keeps our ambulance driver safe, and that is awesome. When drugs are involved and we have an overdose situation, the rule and the awesomeness of that rule kind of get in the way sometimes if this happens really quickly. So EMS wants to come, IRD will come, sometimes Indianapolis police will carry this. We've had some sheriffs that'll carry it, right? But we want to make sure somebody gets there first who's equipped to deal with a medical emergency if they're the first folks that can get there, because they'll roll in and they'll just do that piece, right? So with someone who isn't breathing, with somebody who isn't responsive, we're going to start for rescue breathing, right? To do this, I have to step away from the mic to do this. I don't know how I can do this. We're going to get them flat. Because we're not doing chest compressions, it doesn't matter if they're on a hard surface, right? We want head tilted back, and I want you to check their airway. Sometimes before people inject, they pull caps off with their mouth. Sometimes people are chewing on fentanyl patches. If you take a fentanyl patch out of somebody's mouth, do you know what's going to happen to you? Nothing. Do you know why? Because they had to put it in that patch, and it's got to have 15 minutes of sustained skin contact with your skin for it to go through those membranes. So what you're not going to do is take it out of somebody's mouth and like hold it for a really, which is gross anyway. Don't do that with anything that you take out of people's mouths. We're not going to do that thing. We're not going to put it in our own mouth. It's also not a thing that we do with stuff that we take out of unconscious people's mouths, right? So you're going to get the airway clear, pinch the nose, cover their mouth with your mouth, 3 big deep breaths. This part is going to rise and fall, right? My ribs go down to like here. Somehow I have like a super short torso. All of this is going to rise and fall, but if this bit down here is rising and fall, we have a problem. It's that you're breathing into my stomach and we have to throw up on you. And I'm not going to be able to help it because I'm unconscious. And then you got to do the whole airway clear rescue breathing thing again. So I just need you to tilt my head further back. There's like all these tubes in there and you just don't have them lined up right. It's going to be okay. Just maybe stop and do that if that's what you know. All right. And then we're going to evaluate if naloxone would help. If they're not breathing, if they're not up, if you didn't clear something out of their airway that was somehow like blocking it, and now, you know, they're with it again, then we're going to administer naloxone. These are for our muscular injections because scare me works as an acronym and scaring doesn't. Like Apple. So with these, we just pop them out of these little kits up one side of the nose and you push this red button, right? It doesn't, I can see. That's it. Super, super easy. If they're not breathing, we're gonna give them a couple of minutes of rescue breathing. Every 5 to 7 seconds, we're gonna do a couple of breaths. We're gonna hang out. If they're not up in 2.5 minutes, we're gonna do more naloxone, right? We've called for help at this point. We've got somebody on the way. It's all gonna be great. This last piece though is pretty critical. When we evaluate and support somebody who's just experienced an overdose, when they come up, we are calm in the same way that we are calm when somebody wakes up because they've been unconscious at the hospital and they don't know what's going on. We're calm because a reality was happening and then there was nothing. And now something that we're not quite sure is going on is happening, right? It freaks people out, especially if what we're coming up to is a whole bunch of speed still in our system and no more of a system, right? So sometimes we hear from EMS or we'll hear from law enforcement that we've given people naloxone and they come up and they're super belligerent, they're super confused. Yeah, they are valid, right? When we lose consciousness and something's going on that wasn't going on before we lost consciousness, I'm gonna bet that most people would be really, really weird and kind of belligerent about it, right? So as much as we can keep flashing lights, tons of people out of the face, things going on, the better. When people come up, what we do and what I ask people really to do is to quietly let people know, hey, you've experienced an overdose. This is my name. I gave you some naloxone. Right? And then we're just gonna gauge the situation. People might ask you questions. People might feel ill. This stuff's pretty strong, like I said. If we've got folks who are opiate dependent, they can go through withdrawal. That sucks. It's gonna start to feel better. This stuff stays in your system for a while, but just like everything else, it starts to come off of your system, right? If you have a longer lasting opiate in your system and this stuff starts to pop off, you're not gonna feel like you're in withdrawal forever. It's gonna pop back up. Things will balance back out, right? But those 15 to 20 minutes, if you've got somebody you've given this to who's dependent on opiates, it's gonna feel like 20 eternities. It hurts. It hurts your body. It doesn't feel okay, even if you're breathing. So we're gonna be real nice, all right? And again, with lights, as much as if you've got, folks, community folks on the ground, we've seen some success in talking with, EMS or like, can you just put on the backlights so that we don't have, all of the everything in people's face. Let's like try to limit some exposure. We're going to see if we can't get folks, these are all, and y'all will have all of these. But we can't see if we can't get folks into a resting position, right? On their side, head kind of elevated. And we're gonna ask, even if folks don't go in, for an assessment at the hospital afterwards, if they're up, they can refuse this. What we're gonna ask is just that they don't use again for a couple hours. Because what we don't want is naloxone to wear off. You've had something else in your system, and here we are doing this whole thing again, right? Like, nobody wants to do this ever, but not twice a night. So we've got folks in the rescue position. You might bring a cup of water. You might see whether or not they've got somebody that can hang and stay with them, right? I tend to not leave folks that I've brought back by themselves if I can help it, just because it's kind of a lot going on, right? It can be really strange. If folks, are okay, then you're good to go. All right, so y'all will have the whole acronym. And this is less important for this stuff, but don't keep it in your car all summer. If it's expired, you can let me know. Y'all will have my email address. This is good for 37 years after expiration date. They just studied it, right? So like, don't throw it away if it's expired. It'll still be good. If you forgot, you left it in your car overnight and it got really hot, it's gonna be okay. This stuff, again, is super strong, right? If you keep it in your car for a year, is it gonna be okay? I mean, it might still work, but maybe we're gonna get you some new naloxone just to make sure that nothing super strong is out there. If you guys choose not to, for whatever reason, call 911 after you've administered, I need you to promise, pinky swear that you'll do it if you have to give somebody more than one of these and they're still not coming up. Why? Because what we're seeing in Indianapolis now is similar to what we're seeing around the country. There is xylazine in some of the drug supply. It's not an opiate. I can't do anything for you. There are benzos in drugs that aren't supposed to have benzos. Again, non-opiate. This can't do anything for you. There is something similar for benzos, so it's a little touchier, needs a little bit more medical management, right? It exists. Also, I don't know that everybody needs it. So yeah, we've got all of this. Y'all are welcome to have it. People can put hands on it. I will be here afterwards if people want to, touch and feel and ask questions. If you are doing work at an agency, if you've got a church, if you've got a school community center and want Naloxone boxes for us to come in and do trainings to talk about fentanyl test strips, or to talk about our August project that we're starting, where we're going to be doing lay responder gunshot wound triage trainings. Talk to me. Because yeah, that's kind of our next little thing. What's that?
Just I have your email address. I have a little project further on, so.
Cool. And for us, this is the stuff that makes that whole difference, right? It's like the closing piece. I have a lot of friends that have overdosed and they're not. They're not, they're dead. This stuff was made in the 70s. It was FDA approved in the 70s. And in Indianapolis, we began to be able to carry in 2018. Now, and myself included, have overdosed. This stuff has brought us back. We know in actually just today when we were doing supply deliveries, we got 40 more reversal reports. In the month of June alone, Number Alone Project has distributed over 5,000 doses of Naloxone in Marion County. We get people asking us for it every day. We get the same people asking us for it. We have, over 200 reversal reports just from this month. So we know this stuff works. We know getting it out into the community works, and we know that it's saving people's lives. So yeah, thanks for coming.
A quick question. I have a comment in the chat that says, can you please emphasize how deadly fentanyl is? It's not a casual opioid. It is immediately deadly. People who OD on fentanyl die in their tracks, and EMS cannot get there fast enough, period. Can you talk about that a little bit more?
Sure. So it's super strong. It is, right? And it's very different than the fentanyl that folks are used to getting from any sort of medical procedure, right? This is not the fentanyl that they put in patches. It's not the fentanyl that comes in the lollipops and hand rewards, right? This is not like the stuff that, a long time ago you could pick up in your microwave and put in a nasal spray and be okay, right? Because it's strong, manufactured, often not even actually fentanyl. We have all of these new fentanyl analogs, right? It's hard to keep up with all of them. The really cool thing is that it's all got an opiate backbone. So you're right. EMS often can't get to folks who are loaded up with fentanyl in time with enough Narcan to do anything. That's why I'm talking to y'all about taking Narcan and giving it to people, right? We don't need EMS to show up every time there's a fentanyl overdose. If somebody sitting in the same room as you has Narcan and has enough of it and knows how to breathe and keep you alive. So yeah, it's scary, it's dangerous stuff. A lot of things are scary, dangerous things, right? But when we're dealing in a spot where we've got influx of changing drug market variabilities, the only way that I know that works to deal with it is to make sure that everybody has the stuff in their pocket and knows how to get more, right? The other piece, and I'm going to leave this with y'all about fentanyl, if you touch it with your skin, nothing happens. The patches, something happens. That's really interesting. So they had to make those patches because nothing happens when you touch powdered fentanyl. That's why they have transdermal patches. You'll notice how they don't make transdermal patches of other things that work when you touch them. Like, if it works that way, we would just get makeup containers and powder our faces all day. No one is injecting things that are bioavailable via skin contact, right? There are news reports out there that say otherwise, and that's okay. These things happen. Science, though, says that that's not how that works. So I'm gonna go with that because it's what I know to do. The other piece is that, and I also need folks to hear this, it's not on your kids' marijuana. It will never be on the marijuana because it's not how science works. Fentanyl, just like everything else, has a couple of different really important temperatures. So it's got a combustion point. It's got a molecular disintegration point, right, where it reaches chemical inertia. And the really interesting thing is that fentanyl's disintegration point is about 3 times lower than the temperature at which plant material burns, which burns at a standard. Like, I can't make this stuff up. Like, it's just actually like chemical properties that I have not made do this thing or that I have any sway over. It's just that weed burns at a certain temperature and fentanyl disintegrates before you get to that temperature, right? Can there be other stuff on your weed that makes you feel weird? Oh yeah, absolutely. If you smoke weed and you overdose on fentanyl fatally, or if you smoke weed and ingest fentanyl, will they both show up in a tox screen? Oh yeah, that stuff sticks around for a hot minute, right? So we think probably that there's some of this, correlative overdose data that shows both things. But if it were in the marijuana, someone would have found it. There are mass spectrometers, there's drug testing. Somebody would have said, now we've got this, right? What I tell parents all the time is that this is something you're concerned about with your kids, since we know that marijuana is the only thing that can't have fentanyl in it. Go forward that way, right? Delta 8 is legal here. CBD is legal here. There are some harm reduction things even parents with younger adolescents can talk about. But when we're talking about weed and fentanyl, we're talking about a myth that has been misunderstood that can easily be worked through with like very basic chemistry. I am happy to send people all of those scientific whatevers, but they're there, y'all can look them up. But maybe don't roll around in powder fentanyl because it'll freak everybody out. Terrible habits to do. Yeah, other questions? It's hard to say it's like super dangerous stuff and be like, but also it's gonna be fine.
So what you're saying is it's almost like when first responders say they put their hands in somebody's pocket and they get a week's vacation because they got a fentanyl on them. It's just like, I get a week's vacation and nothing more.
So I don't ever like to question situations that I don't have a personal knowledge of. But I will say that I haven't seen, nor has anyone else in harm reduction, that there's been post-exposure tests that have shown that this is something. And I'll also say that video-wise, I've never seen anybody who's overdosing on fentanyl act in the same way that those processes that I've seen, right? So there's a panic about fentanyl that's very real. And there are kids. I'm not the only person with small children, right? So this one time, my kid came home with a note about how there was lice in the classroom. And like, it was fine. My kid doesn't have lice. It's totally, and by 3 hours later, like I'm almost shaving everybody's heads. I'm like convinced, right? Everybody is itchy, just even like talking about it. I can't talk about it for too long because it's like, right? It's the same sort of thing. Real actual occurrences can be really like not fun to deal with. Fentanyl is more than not fun to deal with, right? But also is not always what is happening. So that's kind of where we get sometimes. Cool.
Does this fall in under a big blanket of Good Samaritan laws?
It does. So you are allowed in Indiana to give people naloxone. You're allowed to use naloxone on somebody who is overdosed. If you call for emergency services and you hang out and do what they ask you to afterwards, you're good, right? I wouldn't suggest, getting up to any other sort of mischief while you're waiting for them to show up. But yeah, you are absolutely allowed to give it. You're covered under Good Samaritan laws. Again, especially with this stuff, there's so little you can do, right? You can't make it worse with naloxone ever. So when in doubt, I always tell people, give them a spray of it, call 911 and we'll see what happens. Yeah, cool. Thanks.
And also if you, sign up for the CERT class, you will learn how to do rescue breathing and preliminary CPR as well. And why you should put somebody on their side with their head tilted slightly up when they are in the recovery mode. And why is that? It's because they sometimes throw up. Yeah.
Thank you, Jess. And if anybody needs a Naloxone box, I put the email in the chat. It's jess@theneveraloneproject.org. She can make sure that this happens. Or send an email to any of us if you have our email, and we'll make sure we get it to them. So thank you very much. This has been very informative. And it looks like we have a few more slides for the public safety portion. I was asked to talk about Crime Watch. If you want to start a Crime Watch organization or Crime Watch in your neighborhood, on your block, get a hold of Steve Talley or I don't know who that is with Kibby. Who is it?
Laura Racing.
Laura Drasick, and that's all this is going to be in the chat as well. We love Crime Watch in Indianapolis. It really helps lower crime within your own community. Finally, if you want to join the Safety Cat team, we need more members. We have what, 4 or 5 people who show up regularly these days, and we want your help. We appreciate everybody who's been here. We appreciate everybody that's online. And again, if anybody needs copies of the slides, I think Rainey, you have put that into the chat as well. So I want to thank her, first of all, Jess Cochran for her presentation. I want to thank you for saving lives. I want to thank Marguerite Topping for all the work that she does. Honestly, I don't know why I'm up here other than I'm prettier. I mean, she should be talking about everything here. I want to thank Chris Staub, president of NESCO, for everything he does for the East Side. And absolutely, I want to thank Rainey Grant for everything she does here. We couldn't do this without you, Rainey. You are our leader. You make this possible. And let's see, do I have any more slides? Actually, yeah, this is the part where I should have said, thank you, Rainey, in the John Bonner Neighborhood Center. And do you have any more you would like to talk before we do this?
Okay, so we're actually not done yet. We do have a couple more presentations if you paid attention to the agenda. I'm going to bring up Melissa Benton, who is the Community Development Officer here at the John Bonner Neighborhood Centers, and she's going to talk a little bit about community-based crime reduction.
I'm not great with technology, so we'll see how this goes with the mic. But thank you, Cliff. That was great. I would like to say, just from an organization standpoint, we have 2 boxes, as I mentioned, on our center. If you are with an organization you work with, attend, know anything, it's very painless. Just brought the boxes out. I told our maintenance guy to figure out where they go. They drilled it into the walls, and that's it. They take care of refilling it. We don't have to do anything. It's completely hands off. So if you have an organization where you would want some of these boxes, it's zero maintenance for you. They take care of everything. Pre-COVID, when they did this training at Ravel, literally like 2 hours after the training, there was a person that overdosed at the Burger King. And some of you may remember Josie, who worked at Ravel, was able to save them because they had that right after the training. So I would definitely encourage it. It's very easy. I hope it's getting a lot of people.
We have doses for everybody to take home, so just don't be afraid to get your Naloxone.
Yeah. The other thing is we had hoped to have a representative here to talk about some new domestic violence resources. She was not able to make it, but we do have these flyers that have a lot of really good information about domestic violence resources. So feel free to take these if you want. I will see if we can get an electronic copy that we can give out either online or to the folks that are on the Zoom. But there are a lot of resources across the city for domestic violence resources and their new Champions for Domestic Violence Prevention program that is happening at the city. So those are available for you guys to take, but don't ask me any questions because I don't know and she's not here. So the other thing that I wanted to talk about was community-based crime reduction grant. So in 2018, the Bonner Center, in partnership with Shepherd Community, which is out on East Washington Street, were awarded a grant from the U.S. Department of Justice to do crime reduction in the neighborhood. I was really excited about this opportunity because this grant is very specifically to do things that are innovative. I think you've seen tonight, there's lots of different ways to approach public safety. Public health is public safety, crime watch, block captains, code enforcement, all of these things can contribute to a safer neighborhood. And so I was really excited to have the opportunity to do something that is not traditional. We started in 2018 having a lot of neighborhood meetings to talk about what folks would want to see happen with this money. We had to have a full year of planning, which we did, and we were ready to start moving towards implementation, and then COVID happened. And so we couldn't do anything else for a while. So it has been a really, really long time coming, but I'm really excited that we have 2 interventions that we're going to be offering through this grant. Before anybody asks about like why we picked these, I'm happy to have that conversation, but not tonight because we only have like 30 minutes. There's a lot of different things that you can spend money on, and there's not ever going to be enough money to do everything that everybody wants. So we took feedback from the neighbors, and we have 2 sort of what I'm calling strategies to address public safety in the neighborhood. And so the first one of those is working with those who have prior involvement with the criminal justice system or are at risk of involvement with the criminal justice system to do some really targeted workforce development. Both Shepherd Community Center and our center here have what's known as Center for Working Families. And so with that comes sort of a personal coach that will help them. We know that people that have been involved in the criminal justice system have more barriers to employment. Some people, employers do not want to hire people that have felony convictions. And so how can we use what we have here to help remove that barrier and help make sure that people who have a prior conviction are able to access jobs that pay a living wage, which is very important when you're talking about reducing crime. At the end of the day, you can disagree with it or not, but people have bills to pay and they have kids to feed and they're going to find money to do those things. And so if we can help them find jobs that pay a living wage, less likely that they'll return to crime. The other one is the one I'm that's really cool. That's really great. I have to say that because Dean that runs our employment stuff is here. So that's great. It's great. But I'm really excited about this other activity that we're going to do, which is a program called Poetic Justice. I did not know that Mark was going to be here tonight, so I didn't ask him to prepare anything. I'm not going to put you on the spot unless you want to talk. But okay, Mark, do you want to talk about Poetic Justice? You can probably do it better than I can.
Sure.
Okay, you do that then. But I'm very excited.
Yeah, thanks, Melissa. So my name is Mark Latta. I live in Winter Park and I've been running around the Near Eastside for 15 years or so. But yeah, we're really thankful that I think Melissa wanted poetic justice as one of the crime prevention interventions. And I'll be very brief. The whole idea is that we use creative writing and poetry and social practice arts to foster peace, peace building strategies, harm reduction strategies, trauma informed strategies. Form cohorts of residents, meet once a week for 15 weeks, and learn how to build something together while we also use writing to kind of foster personal understanding, foster cognitive development. There's a lot of research that we're drawing from that people have used writing in cognitive therapy. They've used writing in violence reduction strategies, through the use of poetry, the use of journaling. So the idea is that we recruit cohorts 10 to 15 people over 15 weeks. We learn different strategies, workshop writing, and then at the end of that, we showcase the different creative works that people have produced, while also training everyone in asset-based community development so they can go later, pass their once poetic justice cohort ends, they can then work on their own projects and can support them in that. That's the basic description. I'm still working on the elevator pitch. So if you're like, what is this? I'm happy to talk to you more about it. But I brought some flyers with me, and really the criteria is pretty simple. If you live in the Near East Side, and if you live, work, or worship on the Near East Side, rather, if you, your family, or your friends have been justice involved in the past or currently justice involved, you most likely meet the criteria. We also provide stipends for people to participate, provide all the forms of support that we can, so it's easy for them to participate, and kind of use writing in a way to really get at some deep personal understandings, then share that in a community stage. So I have some flyers, and I would love to pass them out. If you have other questions, I'd love your help in recruiting people. Right now, we're just trying to get the word out. Our first cohort will actually start in a few weeks. So we got the first cohort up and going, but we're recruiting for, I think we have 6 other cohorts. Yeah, so wanting to do 6 other cohorts, and then hopefully we'll continue beyond that. So, but thanks.
So definitely, if you know of anybody that might be interested, please take a flyer. We have an online link that we can share with you guys. We're trying to recruit for the other cohorts. I will say that I'm really glad that we have this funding that allows us to do something that's a little bit innovative that we haven't done here before. As Mark said, there's a lot of research in other areas where this has worked, and we think that it's going to be successful here. And as somebody who has a felony conviction that spent time in prison, I know that one of the best things that keep people from committing crimes again is feeling like you're connected to a community. When you feel like you're connected to a community, you're less likely to want to commit crimes against that community. So really trying to foster that sense of community, which I think is already pretty prevalent here on the Near East Side. So either Mark or I'll be around. We're happy to answer any questions about that. We will be having a website where we have all of our information updated about the CBCR grant, so you can go there and get more. We're gonna back it a little bit because we missed some things because of COVID. So we'll put up all of the information from the neighborhood sessions that we had. And then going forward, we'll put up information about things that are happening around it and what some of the statistics are. We are working with IEPUI to help us do an evaluation of the program. So we will have an idea of if this worked or how well it worked or what that did. And so we will have all of that information on the website so that it's easily accessible for neighbors to see. And if it says it's successful as we think it will be, then we're hopeful to continue to find funding for it in the future. So I think that's all I have. Okay.
Very excited. I'm able to give you all the good news that I'm going to give you back half an hour of your evening. Just before we go, again, if you have any questions about the safety cat or about CBCR or anything, please feel free to stick around until 8, and then after 8, please leave. And I wanted to let you all know that there'll be a lot more community engagement plans this year. So looking at one-off events, some smaller roundtables, hopefully coming up in the next few months. If you are interested in getting involved with quality of life, please feel free to email me at rgrant@jbncenters.org. If you need me to spell that for you, you can come up to me later, but feel free to email me there. I'm always looking for more people to get involved, and a lot of our other community action teams, unfortunately, are inactive at this time. The safety cat is very special in that they're very active. And so we might be looking at, if possible, getting those other community action teams to be active again until we get committed community members to lead those teams. They'll probably remain inactive. And we'll be looking at other ways to engage community members in the quality of life team, because it's not about the lead agencies, even though I say thank you to them. It's really about trying to get the grassroots level approach and making sure that the community, which are the residents, feel like they have the power to improve quality of life on the Near East Side. So again, let me know if you're interested in getting involved, and I hope that you all take some of the quality of life flyers out in the hallway and share them with your friends and family and neighbors, so that they can get involved. There's English and Spanish on either side. So, and we're also looking to get our Spanish speaking neighbors more involved as well. So please keep a lookout. Subscribe to our Near Eastside newsletter on our website, and that's neareastnam.org. Follow us on Instagram, Facebook, wherever, whatever you have. Just please stay involved with us, and yeah, hope to see you at the next summit or the next event. And thank you all for coming.
So, right now.
Good to see you. I appreciate you.
What does the word?
Hey.